you sent me the link today, so you can just go to your sent.
I'll just check this. Copy.
You hear the music in the background?
Yeah, we should turn that off too. That I don't know how to do either. It's gotta be one of these things. Better?
Is it better if I just stay there?
You can stay here.
If there's questions coming in, the only way, you might be the only one to be able to see the questions.
I have my computer, so I can pull that up if there are any.
We ready?
It is buffering a lot, but audio is clear, she says. So.
Can you see me if I'm right here? No? Okay.
It's a little choppy, but she said you can hear fine. You wanna start?
We can start.
Okay.
Hello everyone, and welcome to this very special event. I'm Garman, the Medical Director of Coal Country Community Health Center, and I'm privileged to have with me today Beulah Public Schools and Mr. Miller, Superintendent of Hazen Public Schools. Today we hope to talk a little bit about what's going on with our school systems, and then also answer some of your questions about the coronavirus pandemic and some things that we've found on Facebook that you've posted. So first, I'd like to start out with a question to both of you and ask you to give us an update on the current status of the schools in the Hazen School District and the...
Go ahead.
Okay. I'm Ken Miller, Superintendent at the Hazen School, and I guess an update for us, today was our first day in our high school that we actually went 100% distance, and this was just for our students in grades 9 through 12. With our grades K through 8, we are continuing to have 100% in-person learning. The reason why we actually changed from that regular type of person-to-person learning to distance is because of the current positive cases we've had in our school for corona, and also the numbers of quarantined staff members. And the last thing is the number of students in grades 9 through 12 that are currently not feeling well and have missed school. An example would be we currently have 5 employees in the high school that have tested positive for COVID, and we have 9 additional staff in the high school that are being quarantined right now. And 2 of those 9 are actually waiting for test results. Yesterday we had 22 students in our high school that were out sick. Not all of them possibly with the symptoms of COVID, but I would believe that most of them have at least one of those symptoms. So just because of us as a school district not being able to fill with substitute teachers and employees to fill those spots for those 14 employees, and also for the concern of our students that are ill right now, and we do have 28 students that are also being quarantined at the time. We just felt that this was a good time and an opportunity for our school district to do learning distantly and try to get our staff and our students healthy again.
Okay, thank you.
You're welcome.
Almost. Mr. Jordan.
Yeah, we are still 4 days on, Monday through Thursday, with Friday being a distant learning day, which has been going fairly well for us. We too have cases that are in our school system. We have currently between 50 to 60 individuals, staff or students that are currently quarantined. We do have 2 positive staff and a few positive students in our district. We too have students that have gone home that haven't felt well. and they're either awaiting a test or they're not coming in to get a test for any reason. But it's a grim situation from where we were at the start of the year. We still feel comfortable with 4 days on and 1 day off. We currently have no teachers that are being quarantined.
Thank you. So a question that I hear is, so you guys are both superintendents of the schools. You're the bosses, right? So you set the rules. Why can't you just open up the schools? If you say so, open it up.
It doesn't matter, but we do have some autonomy on what the deliverance model of our schools look like. Our school boards have the autonomy to make that call. So whether you're a hybrid or whether you're 4 days on or whether you're 5 days on or whether you're completely distant, we do have that authority, but we also have to weigh that against the risk. And we're starting to see that COVID is in our schools, and so keeping them open, keeping our schools open is going to take a concerted effort. And so, we have guidelines that we have to follow, as you alluded to, from the North Dakota Department of Health, Public Health, the CDC. We follow all those guidelines, and we try to do what we think is best that's going to keep our schools open, and try to mitigate risk at the same time. And so it's a tough call. I mean, I think every school district has some different, even maybe Bismarck, Mandan are different too, but it's one of those things, and I guess it depends on your geographic too. I mean, how many kids do you have in school? Can you socially distance kids in school? Are they wearing masks? And so those are all things that you have to take into consideration, and we have. And I know Hazen has too. So
We end up taking advice and working with outside businesses, community leaders, other school districts. And again, we just want to make sure that we do the best for our kids and our students. And whether or not we're just definitely going to stay in school just to stay in school, we as school districts don't operate like that. We take a lot of collaboration from others, and we try to make the best decisions that's going to be the best for our kids. And sometimes those decisions aren't the best decisions for everybody, but I just want everybody to know that the decisions that we do make, we make them going to bed at night knowing that we're sleeping well because we know that we're doing the best decision that's best for the majority of our kids and our staff.
Great, thank you. So in trying to make those tough decisions, it's got to be frustrating. What's the biggest frustration that you're facing in dealing with the reopening of schools?
I think the biggest frustrations and the challenges that we have seen in our schools is our kids are great kids, and they'll do whatever you tell them to do in the school setting. Like for instance, the mandating of masks when we can't distance ourselves. Our kids have been really, really good about doing that. Our staff has been really good about doing that in school. But one of the frustrating things that I have seen is once the bells ring in the afternoon and the kids disperse and you go to activities or you go to the grocery store or the gas station, and it's just like everybody reboots and kind of forgets the reason why we're doing the things that we're doing. But those are probably the biggest frustrations, is just we have good practices in school, but that's only for 7.5 hours of the day. And it's challenging to see that we're doing things differently in the evenings and in the mornings, and that's probably my biggest frustration.
Well, for you, Mr.
I agree completely with Mr. Miller's sentiments. Our kids do well with masks at school. We're doing everything we can at school to mitigate risk, and I think, and you'll allude to the science of this, I think, a little later, but students don't transmit this disease as prominent as adults transmit the disease. And so you're right, when kids leave our schools and they're out in the communities and we're not practicing the things that we should be practicing, that's where we're getting the COVID into our schools. The other thing that I think is very frustrating is we have kids at home right now that are missing opportunities. they're missing connection. They're missing out on their dreams of playing in the activities and being with their friends. And the frustrating part on that is we're trying to do what's best at school, but then it's filtering into our school, and therefore, the CDC requirements haven't changed. It's still 6 feet, and quarantine rules are still quarantine rules as of right now. But there's a mental health aspect of these kids that worries me dramatically. And when we have 50-some kids out quarantining and they have no symptoms, they're missing out on opportunities they're never going to get. And so, I would just say to the communities that this might be difficult to wear masks. It might be difficult to not gather in social gatherings. But if we really want our schools to stay open, we might have to we might have to be inconvenient and wear masks. And that's the reality of our situation. And so that's my biggest frustration, is that we have kids that are missing out. And last spring we had kids miss out. And it's sad because ultimately, in a lot of cases, the school is the safest place for some of these kids, and it's the place that they feel comfort. And when they're not there and they're distance learning, which is not ideal, we agree that it's not ideal, we've got to find a way to get them back into school, and mitigating the risk as best we can in our communities as a whole will help us get there.
How have you had to adjust in dealing with all these challenges that you're facing?
He said sleep well earlier, and I was like, what's that? But, for me personally and for the school adjusting, I'll just say that the biggest adjustment has come with our teachers. I mean, if you go back to last spring and we asked our teachers to basically flip their entire model of education in 3 days. And, I can speak for my teachers, and I love them to death, and I love the work ethic that they're putting in, but the biggest adjustment has come to them. They're now doing double work, and it's not easy. And 90% of the people are supportive, but it's the 10% that will say something on social media, and teachers are human beings too, and they see that stuff. And the workload for me has been tremendously more, but I can't imagine the adjustments for our teachers. And as far as COVID adjustments, we've done a lot of things to mitigate the risk. We're wearing masks, we're socially distant. We have now limited fan attendance at our games. We're making masks mandatory at our events that are indoors. But kudos to the teachers on what they're doing, because it's unprecedented, and I can't imagine, talk about sleep well. I can't imagine that.
Absolutely. How about you, Mr. Miller?
I do know that we're just asking so much more out of our teams and our schools. And the thing that I'm proud of my team at the schools are they haven't complained about it. If they have, they haven't to me. That they know that there's extra pressures on them. They know that there's extra work that they need to do, and they see those challenges, and they've accepted them, and they're working hard to do the best for the school. And it just isn't our teachers, it's all of our staff. It's from our administration to our support staff to cooks. And if you can find positives out of this, you can find that a group of people willing can get through anything. And I really truly believe that if we continue to do our part in what we need to do when it comes to some of the recommendations that we have from the CDC, our North Dakota Health Department, and we actually execute those, I really truly believe that some of these challenges we will conquer and end up having more positives than negatives. But I've seen a lot of tears from staff members and including myself. Been a lot of challenges this year, but I think if we continue to work hard as teams, and not just my team in Hazen, but working with Mr. Jordan and his group, and healthcare opportunities we are very fortunate to have in our county, we're we're going to get through this.
So for both of you, what's the path back to getting normal? What do you see as your path back to getting normal?
I think one of the things that we need to do is not hold our emotions in and not just fake it. And I know I'm probably the biggest faker there is when it comes to my emotions, and I'm probably the best at doing it. But we just need to take care of ourselves. I know just this week, I didn't have lunch because I didn't have time to have lunch. And I know I'm not the only one that it's like that for, but we just need to remember to take care of ourselves, not just our emotional selves, but also our physical selves. We just need to get out and exercise, get some walks in, spend time with loved ones, and be able to talk about some of those frustrations that you have. And I think if we can keep ourselves healthy, we'll have a better opportunity to be able to come back to that normal, because hopefully ourselves will be able to keep our minds fit and our bodies fit. And if we do that, I think we might be able to see some normal again.
How about for you, Mr. Jordan?
Yeah, I agree with everything Mr. Miller said, and I don't know if we're ever going to see normal like it was. I think we're always going to be cautious, and I think mask wearing is probably going to be something that people do. Getting our kids back to school 5 days a week is not just what we do at the school. And I said it before, it's going to take an effort community-wide. And I've been in different schools, and I've been on all sides of the state, and there's something special here in Mercer County. And if we truly want our kids to be in school 5 days a week, then it's going to take all of us doing what we need to do. I keep saying, like, going to war had to been hard. Wearing a mask is not hard. And I know it's inconvenient, and I know it can be political at times, but we really need to do what's best for our kids, and what's best for our kids is being in school. And so I'm going to ask that we mask up, and we do the things that we know that we can do to mitigate the risk of this disease. We wash our hands, we stay away from large gatherings, and then the kids are going to get the opportunities that they deserve. They're not going to miss out on things that they'll never get to experience. And so that's what I think we need to do in Mercer County, and we've all seen an uptick of cases in Mercer County, and now is the time. We can beat it, but we've got to work together to do it, and it can't.
Thank you both. So I do have a question that I'd like to address, and it goes back to what you were talking about with masks and mask wearing. The question was, and I'll just read it, I have a question, and if any of you know the answer, I'm confused about this COVID thing. If we are wearing masks to protect ourselves, then why are we quarantining people and kids that have been wearing masks? I just don't get it. Is the mask not there to keep you from getting COVID? And if the mask isn't helping, then why are we wearing them? Some kids in other schools are not quarantined after a positive test in their classroom, and yet other kids are quarantined after a positive test in their classroom, all of which were situations where masks were worn. I'm not judging any school or people for decisions that are made, just trying to understand the whole thing. And this part makes me sad. Please no hate talk or bashing. Answer this. I want to talk a little bit about masks, because there's a lot of confusion about masks, and I'm going to try making it really simple. So if a kid is exposed and they're wearing a mask, why are they sent home and quarantined? There's multiple answers to this and multiple pieces to this answer. Masks have a very rocky history. Before coronavirus, before this COVID outbreak, pandemic, there were no good studies at all about masks in public, okay? There isn't one. There's not a single study. So when people were asked originally about wearing masks and preventing spread of disease, nobody had a good answer because there wasn't one. There wasn't data to support it, right? Now, since science is catching up, there have been numerous studies. Some are just case studies, some are just anecdotal studies, but numerous times we've shown that masks do mitigate disease. They reduce the spread of disease. There's also a randomized controlled trial which has proven that washing hands and wearing a mask limit the spread of disease. So, whatever you've heard in the past, whatever your thoughts were in the past, please just let it go, okay? The data's out there. Masks help prevent spread of disease. So now we can move forward and we can try to do just that, try to reduce community spread. Are masks perfect? Do they prevent every person from getting coronavirus? No, absolutely not. When I was a resident, I delivered a lot of medicine training as delivering babies. And I delivered several babies whose parents were using birth control. Nothing is 100%, okay, including masks. They don't prevent of disease. They help reduce risk. Washing your hands helps reduce risk. Wearing a mask, reduce risk. Socially distancing reduces risk. None of it is perfect. So if you've got a kid in a classroom and they're wearing their mask and they're trying to wash their hands and kind of socially distance, but I don't know how you socially distance second graders. I just don't, I can't fathom that, okay? Then when you look at the CDC's guidelines and it says, was the kid wearing a mask? We assume that it's a good mask. We don't know if it's a good mask. We have to assume that they wore it all the time, that they didn't take it off. Well, we can't make sure of that. Nobody can. And that they didn't just sneak it off, have a drink, or do whatever where they're playing with their friends. So nobody can be sure that the kid was wearing the mask appropriately at all times. Therefore, again, all of these things reduce risk, but they don't eliminate that risk. If the child is then exposed in the classroom, the next step is to say there was an exposure. We can't prove that that child fully had no risk, so we need to quarantine. We need to take that group of kids that were potentially exposed, that teacher, whoever it is, and put them in quarantine where we can have them watch and see if they develop disease. I hope that nobody in quarantine ever develops disease, washing their hands. But in order to stop the spread of the disease, we need to carve out those possible positives from the general pool, okay?
You said one thing about why does one kid have to quarantine and one not? Maybe it's important to say that, you know, the Department of Health and Public Health has certain guidelines, and actually you are training to be contact tracers. And so when we have a positive case,